Do you think that well, maybe there's some hard data on this, but has the I don't know, the growth of doulas, has it gone up over time? Are you seeing that it's becoming more, I don't know, mainstream, more kind of accepted, and so more doulas are out there for people,
Yeah.
especially with like the program you mentioned, and I had heard about it, where as like an employer benefit to offer
Yeah.
it to their employees as like, hey,
Yeah.
we're going to pay for this doula
Okay.
service should you want to use it, which I think is so cool. That's such a great way to get it in,
Yeah.
like at volume, right?
Mhm. So there's employer benefit, and then there's um, benefits for clients. So if it's within healthcare, it'll be like, interfacing and then intrafacing. Um, I think that we're seeing it, definitely seeing it more. I mean, just like say from our own experience of, working with like CVS Health and designing a nurse care manager doula competency training with them. They wanted to know, like, how do we have the same skills, right, the doulas have, and fold that into the work we're doing with high needs patients? Like they wanted that, like the
That is
nurses,
so
you know,
cool.
the way that we approached it is like you already know a lot of these things. It's really about like what additional veneer of support and skills can we add on to what you already know, and how can you bring this work to life inside the settings you're in, and how can we ensure that doulas are integrated. And so a lot of what we do outside of just, teaching doulas, obviously matching doulas with families and supporting, healthcare systems in those capacities and their capacities for building up their teams of doulas as well, is program development. So like CVS is a great example, like, developing educational tools and resources for hospital systems that want to figure out how do they language about doulas and the support that's offered within their healthcare system, or a program that we're just now about to do with one of our larger healthcare systems here, which will be really ensuring that like all of the staffers, not just the nurses, but the doctors also learn this baseline training. And so they'll get like, so we're developing a training for them. A lot more doulas are in the workforce for sure, but what we've been able to do is bridge the gap between providers and help people understand how they could utilize these skills, how it can help impact and inform, but also improve the services they're offering already. And yeah, and then also ensuring that we bridge sort of medical and academia together, right?
Mhm.
Because I think that, these spaces are like over here. Like, I think people don't think about doulas in that context. I think about it as a profession, right? And professionalizing people, educating people, leveraging academia, and as well as research, because we're big on research too. And that's how we've been able to sort of grow this. But yeah, we see it all from this lens, right? Because we're involved in so many projects. So we do know that the landscape has expanded tremendously.
It sounds like you've been pretty well mainstreamed at this point. Are
Yeah.
there, and I'm a baseball fan, I like statistics. Brass tacks, do you have any like hard statistics on the effects that having a doula, like does it, like that cesarean rate, that surgical birth, like do you have real numbers on how much it brings that down, how much it affects
Yeah.
the postpartum depression side of
This is
things?
a
And
great way to wrap up
Yeah, we
this conversation. I love
yeah,
it.
yeah. So the presence of a doula results in a 9% drop in use of pain relief, so pharmaceutical pain relief. So 9% drop, a 28% fewer cesarean sections.
Oh,
there it
Um,
is.
that's the
yeah,
one right
The
there.
big number.
Yeah.
28% fewer, right? Which is huge.
Yeah.
Yes, definitely increased maternal satisfaction. We don't have like this exact tactical data on that, because also we have like poor reporting, but we do know is that as people experience the support of having a doula, that if they have baby blues or postpartum depression, that it resolves faster as a result of having that doula present. You know how it's like tax season and people get really nervous about finances and nervous about money. And I think it's a really kind of fraught period for people. But then when you call your accountant, you know how they're like non-judgmental and they're just like, oh yeah. And you're like, and it's,
Yeah.
for some people, it's like such a, emotional process. And they're just like, it's just numbers, right? And so doulas are like this, right? And so you can come, you're like, oh, I'm anxious to, say this is going on, or this thing is happening in my life, or I don't have this money. It's like, okay, but you need the support. So we're going to figure it out. Like, that's the energy. Like, you're meeting people who get that you're human and get that there are actual barriers, right? There's actually structural barriers to support because this country, we've built systems against caregiving. I mean, we really just have. And so, yeah, it makes sense that you don't have the money saved for this, or that you don't have a community to lean on to. And so part of what our job is as members of this community and of this field is to ensure that we can handhold people. And so if I can't do it, I'm putting you in the hands of somebody who can. And that's really how we work. And so I want people to not feel embarrassed, like, oh, I don't necessarily have the finances. That's cool. There's programs where we literally have programs where we pay for it, through the funding that comes through the foundation, or we have it through a grant. And so it's paid for. Doulas are paid for. You just get to fill out a form. It's brief. And then you get to have the services, right? And so you get to keep your dignity in that process. One thing I learned early on about myself, and that I feel like is helpful for some people, is figuring out like what side you're on in terms of where you like to put your energy, right, towards change. And so some people are part of system dismantling, right, breaking things down, catabolizing, metabolizing, like, and then, breaking things down, destroying things, picking them apart for reform, right? And then there's other people who are into building things. And so those people are, with this, these big imaginations, big ideas, and then they execute. And so I think figure out what side you're on. Are you somebody who's going to take your sledgehammer and start, what I'm saying, breaking down these bricks of this system, because we needed to fall, right? We needed to change. So are you that person, or are you over here building the future? And if you're a builder, and I consider myself a builder, and I love building things.
I'm a builder. Yeah.
We're builders, right?
We're builders.
We're builders. So join us on the side of building,
Yeah.
because we're needed. Because what's going to happen is when this thing crumbles, whatever this is, right? Whatever this system is that's going to change, like we're watching it change, and it's kind of frightening, right? But when this is done, people need a place to go. And that's why they come to us. They come to us who build.
This has been a Shut Up production.